Welcome back, everyone. You're still tuned to Saudi Mornings, and well, that was our newsroom, and we had the latest of the news updates from the kingdom and from across the globe. But just before that news segment of ours, we were with our Child's World segment, a beautiful segment, especially the report that our reporter compiled for the day, which was focusing on young students, school-age children, actually, not even young students, but school-age children, and helping them to understand the lines of business and how it is that so many of them were able to pick small tips about entrepreneurship in the future, and how it is that they learned the basic skills of establishing a business, starting up something very, very small, home-based industry, home-based business, and how it is that they go about it. These kind of events truly promote the children to think more about themselves, to think more about life. I mean, it was just amazing, Waleed, with utmost pride, how some of the children were saying, oh, I made lots of money, or I made this much money. It's truly remarkable, and I think more schools need to enroll in programs as such.
True, very also true. So I think these sort of kids, also children, the way also how they're acting, and the way they think, that definitely is something to be very proud of also in such an event. And also I think the way they focus also onto life itself is something also that's for us also as Saudis to be also very proud of. But also speaking also about our of course next also segment, which is the studio also discussion with health and medicine also. Our guest here of the day is Dr. Ismail Al-Badawi, consultant also and section head of trauma surgery and of course gynecology as
gynecology and oncology.
Gynecology also at King Fahd, at King Faisal, of course, hospital. First of all, Doctor, good morning. Welcome to the show.
Good morning. Thank you very much for hosting me today.
It's a pleasure.
Thank you.
Doctor, also, for example, speaking about the most common tumors, let me say, or that actually, or cancer in general, that hit, for example, the woman itself. Many actually would go to breast cancer, but there's also other very common, let me say, tumors that may affect, let me say, and then also the woman in general.
Sure. Thank you very much for asking. Definitely, breast cancer is the most common, but it's not getting treated by gynecologists like myself. We treat women cancers like uterine cancer, cervical cancer, ovarian cancer, fallopian tube cancer, vulvar cancer. Among those, the most common is uterine or endometrial cancer, the woman womb cancer, and then followed by cervical cancer and ovarian cancer. The incidences in Saudi Arabia, we can see in, for example, like a cervical cancer, we can see about 177 cases per year. Unfortunately, about 55 of them would die from their disease. But this disease is preventable, treatable, especially if it gets picked up earlier on. And better than that, it can go through stages which is before being cancer. There's certain changes happens, and this can be picked up with routine investigation like pap smear. And the best news now, it can be even prevented to start with. And this prevention is a very simple measure called vaccination now, which to my surprise, it's becoming the routine practice in many countries, States, Canada, most of Europe, and some Arab countries, but still some of our patients here do not know about it, or actually know quite superficial about it. There is a current vaccine available in the market which can prevent cervical cancer.
Well, I would say, Dr. Ismail, that we need to create tremendous awareness about it, because for myself as well, having done a medical show for 5 years, I have been completely taken by surprise to hear about the vaccination for cervical cancer. I mean, I read the study of Dr. Adil Al-Megrin and Dr. Kate Rittenhouse-Olson when they were trying to discover a vaccination for cancer which treats the antibodies which are around the cancerous cells, so it stops the cancerous cells from spreading in the rest of the body. But then again, you know, that did not really get to the markets as yet, and they're still doing furthermore work on it. But to hear a vaccination for cervical cancer, I think it's just like totally miraculous. I mean, for somebody like myself who has been so close with medicine, so I feel that it's really very new to lots of the women out there as well, who do not hesitate to get the vaccination, who do not mind paying any price for it as well. So I think that we need to create more awareness about this particular vaccination. Though we are doing a lot of awareness campaigns for breast cancer, but it's something that, I mean, only with early detection you could get help. But for cervical cancer's vaccination, it's totally remarkable. But now with this, Dr. Ismail, please tell us a little bit more about these kind of gynecology, oncology related complications. Who are the women who are at risk? Is it the women who are of age, before childbearing, after childbearing? When is it that a person becomes more susceptible to all of these gynecology cancers?
It's actually a very good question, and I wish I have one answer for it, but actually it depends on the site or the different cancer. For example, ovarian cancer has got different risk factors than in uterine cancer, than cervical cancer. Let us go to the most common, uterine cancer. This cancer is quite an interesting cancer. I think it's preventable. It goes with excessive hormone secretion, the woman hormone like the estrogen, which goes with so many things like obesity. So obesity increases the risk of uterine cancer. Having infertility or less number of children, and there's certain syndromes called polycystic ovarian syndrome when women are infertile, have got irregular periods, so they have got their uterus is more exposed to one hormone only, which is called the estrogen. But the good thing about it, it doesn't get diagnosed at late stage, because simply the first sign of such a problem is abnormal bleeding. So bleeding at times which is not expected outside the monthly periods, or especially bleeding after menopause, after women stopped having her periods, suddenly she gets abnormal bleeding. Most women should go to their physician, and with a simple office procedure, it can be diagnosed early, and the treatment is curative, completely curative. Plus, the use of certain medications like oral contraceptive pills, if it's used for 5 years, it reduces the incidence of uterine cancer and ovarian cancer by 50%. We come to a subset group of patients whom have got hereditary disorders. They can inherit it from families. It comes into genetics. About 10 to 15% of the cases of uterine or ovarian cancer comes with inheritance. Same like breast cancer. Certain group comes with inheritance. So it's very important, if many cases in one family have got such a disease, to seek a physician and ask for, and there is very well-known established blood test to detect such a thing.
We have got some of the
pictures also.
Yeah, indeed.
Yes, these are pictures of normal breast tissues, and basically it highlights the self. I can't see it.
Yeah,
it
of
highlights
course.
the. I'm just saying I can't see it really clear from here, but it's. It highlights the importance of self-examinations. What's this picture?
Indeed, certainly.
Okay.
But Dr. Ismail, actually, the pictures are
Yes.
going to be on a roll, but we're mainly focusing
Sure.
on gynecology, oncology.
Sure.
And talking about that, you just mentioned that family history could be very relevant and significant.
Absolutely, absolutely.
So tell us as to what would be relevant family history. I mean, who are the people that, you know, that should really be considered as part of your
Sure.
family history?
There is certain types of cancers, which it's very important to clarify it here, because people would not think any cancer can be inheritance. So there's certain history in the family which can be interlinked. History of ovarian cancer, breast cancer, male prostate cancer, colon cancer, endometrial cancer. These are cases, if it is repeated in the family, we should really dig carefully about if there is this strong family history, and then we have to take certain precautions. For example, if a woman have 2 first-degree relatives, her mother or her sister had breast or ovarian cancer, she really has to do one of 2 things. She has to start investigation for the presence of any of these cancers in herself 10 years younger than the youngest member of this family by doing mammogram, taking certain blood tests like tumor antibodies in the blood called CA125, and do an ultrasound. And the second thing, which is fortunately not available here, but there is certain labs can send it to the States to detect it. It's called the genetic diagnosis of the cancer, called the BRCA, B-R-A-C. It's a blood test. It can tell you if you are susceptible for this cancer or not. The question comes, if you carry the gene, if you know you are susceptible. Then there is sometimes you have to do things which doable, like taking oral contraceptive pills to prevent ovarian cancer, or removing the ovaries. And then you have to balance the risks and benefits of removing an ovaries in a healthy woman, or even removing the breast before having a disease. And then having to live the consequences of early menopause and the cosmetic reasons and so on. So it needs very careful counseling and careful detection of the risk. And then women have to make their choice.
Certainly. So it's your mother and your sister who you have to be
First degree
consulting.
relatives, yes. Our first
Right. And what about your maternal aunts and people?
If there is more than two in the same family chain, yes, you have got. If there is more than two, and there is one first degree relative as well, that would increase your chance.
Certainly. Now, given, let's say, in a family, if a mother is one who has suffered with ovarian cancer, uterine cancer, any of the cancers, is it going to be only within her daughters who have to be maybe going for routine testing, or even her sons as well?
Very good question. I was trying to avoid it. There is something very uncommon, but gives a very strong indication for having a family history of breast cancer, which is called male breast cancer. A male can get breast cancer, but that would tell that there is a very strong family history of breast cancer. If the same person gets breast cancer on both sides, one side and followed up on the other side, that gives another strong indication. And then she doesn't have to worry only about her sons, she has to worry about her sisters as well. And then another question, the circumstances. If she gets the breast cancer in an early age, below the age of 50, is totally different than getting it in the age of 70. We have to know one thing. Breast cancer is a very common cancer. So there is a random opportunity for a woman to get a breast cancer, which is different when she's at the age of 20, the incidence is 1 in 2,000, than her incidence of having breast cancer at the age of 80, which is 1 in 8. You can see there's a huge difference. So if a woman, only one member of the family, gets a breast cancer at a later age, likely it's a random. It just happened. But if she gets it at an early age and it happens in another family member, then you need to be alerted. I'm just saying that so nobody freaks out about when there is, because I'm sure every family has got a member or two having a breast cancer in one of their grandmothers or so, and a colon cancer in one of the
And God knows how many of the people in the old families have even died without ever being diagnosed.
Absolutely correct. Absolutely
So
correct.
you don't really know what is relevant
The
history.
number 1 to 8, you mentioned that
1 in 8.
after the age of 70.
Yes. It's called lifetime risk of developing breast cancer in a woman is 1 in 8 when she reaches the age of 80.
And vaccination, for example, or to avoid such, for example, a case. Is that possible?
Actually, vaccination was with cervical cancer. Unfortunately, no vaccination had been made yet for breast cancer, but we have got a very good, effective program for early detection of breast cancer, which is called the mammogram. Mammogram and self-breast examination, which is probably some of these pictures were about, if I see it correctly. It's basically self-breast exam and mammogram every year after the age of 50 is really associated with early detection of breast cancer and reducing the overall dying or mortality from breast cancer.
Well, also, doctor, I'm asking you, for example, we see in so many cases, for example, people who are so healthy, men or women also, healthy lifestyle, they don't smoke, for example, they exercise also at a very, let me say, old age also. They eat vegetables with vitamins, and also they do get cancer. What also is, I mean, where is that possible also? I mean, what could be the cause? Is it nature or?
There is variables, there is chances, risks we can control. And there are risks we cannot control. We are whom we are. There is genetic part, we cannot change it. But there is variables we can control. We can control smoking, diet, weight reduction. But we cannot control our gender. Being a male is more susceptible for lung cancer. Being a female, just being a female, is susceptible for breast cancer. Carrying the gene in her blood is suscepting her. But let us look from the positive side. Because do we have to? Nobody knows who's going to get cancer, who's not. So why not to live a healthy life? Plus, you will God forbid, a person gets cancer, male or female, old or young, they are more prone to go through the treatment in an easier way, to survive it if they have got a strong, healthy body. If you are starting good and solid, you will tolerate all these nasty surgeries and chemotherapy and radiation and the psychological effect of having cancer than somebody who's starting weak and debilitated. So it's a journey. Some people have to go through it. Nobody chooses to go through a journey of cancer treatment. But you have to have certain weapons. Some of them is your weapon and some is moral support and physician support.
How important, Dr. Ismail, in your opinion, are the free, let's say, government cancer detection centers, so that, let's say, that our the significant part of our economy that goes towards health, and so much of it goes towards treating the people who have already acquired cancer. Instead of all of that, if we have maybe early detection programs, cancer detection centers where people can go free of charge and go and perhaps, like, you know.
The two most important investment national programs are health and education. It's not free. Actually, we are investing. If we make such a centers, which we are referring to as free early detection, it's actually saving us millions of reals on the long term for treating patients with late cancers, saving us millions of reals from them getting absent from work, leaving their families dependent on others, and creating indirectly charities and load on the government. If you detect early their cancer and treat it for free, you are actually investing a lot on the long term.
And what's your advice to the females who are watching you right now, especially when it comes to gynecology, oncology cancers?
Okay. Early detection is the best. All female malignancies, all female cancers are curable, treatable, curable. We know the treatment and we know everything. When we compare our rates for cure from these cancers to everything and everywhere else in the world, it's the same. The problem is the detection. They come late. 2/3 of our women come late when their cancer is already spread at a late stage compared to outside when it comes early. So it's not a better treatment outside, but early detection. Early detection is simple. Go to your physician every year, have a very simple measures like pap smear, ultrasound, and take the cervical cancer vaccine. And this way, God forbid, if you detect it early, you can be treated much easier way without affecting your ability to have babies, without affecting your ability to work and to enjoy your life. And now you can even prevent it, which is even better. So it's all available, but it's for us to go there.
Great advice, Dr. Ismail Al-Badawi. Of course, the subject there was definitely women cancer also, or women tumor. Doctor, it was a pleasure. I definitely, let me say, I think it was a big add to me also personally, and some very important information also. And I think, I hope also the society in general gets that awareness also, that education also about cancer by itself. But thank you so much.
Thank you, I appreciate it. Thank you.
Dear viewers, also currently go, of course, to a small report, also a cartoon segment. After that, we'll be back also to continue our press selection, so stay tuned.